We did the front squat. To perform the proper front squat, one should start by setting up a barbell in the squat rack at chest height or slightly lower. Step under the bar, placing it on your front of your shoulders. Lift the bar off the rack by straining your hips and knees. Stand with your feet shoulder width apart or slightly wider. Initiate the squat by first breaking at your hips and then bending at your knees. Continue descending until your hips are at or below the knee level. At the bottom of the squat, your thighs should ideally be parallel to the ground or lower. Push through your heels to begin ascending. Fully extend your hips and knees to return to the starting position.
The first major group of muscles used in a front squat are the quadricep muscles, which include the vastus intermedius, vastus lateralis, vastus medialis, and rectus femoris. The quads work in knee extension, and this can be seen primarily in the ascending part of the front squat. The next group of muscles are the glutes. Specifically, the gluteus maximus is responsible in hip extension during a front squat. This is key to achieve full extension and getting through full range of motion. There are also 3 hip muscles that are used in a front squat. They are the iliopsoas, the tensor fasciae latae, and the piriformis. They work in hip flexion and keeping the hips stable through full range of motion. Another major group of muscles used for front squats are the hamstring muscles, which include the biceps femoris, semimembranosus, and semitendinosus. They are used for knee flexion and hip extension.
The glutes contract concentrically during the upward phase of the front squat. The glutes also contract isometrically during the entire front squat movement. As you lower your body into the squat position, the hamstrings undergo eccentric contraction. During the upward phase of the front squat, the hamstrings contract concentrically to assist with hip extension. The concentric contraction of the quadriceps happens as one rises from the squatting position. The quadriceps also contract isometrically during the front squat, especially when one holds weight to maintain the knee joint at a fixed angle. The hip flexor muscles contract eccentrically during the downward phase of the front squat. The main joints involved in the front squat include the ankle joint, the knee joint, and the hip joint. The ankle joint is a hinge joint that allows for dorsiflexion and plantar flexion to occur. The knee joint is a hinge joint that allows for flexion and extension of the leg. When performing a front squat, the knee joint allows for one to descend into a parallel position and ascend into full extension at the top. The hip joint is a ball and socket joint that allows for hip extension and flexion that are essential in gaining depth and proper mechanics when performing a front squat.
In order to hold the barbell in the correct position, the wrists will extend, the elbows will flex, and the shoulder will flex. When lowering into the squat, the hips will flex, the knees will flex, and the ankles will dorsiflex. When driving up through the squat, the hips will extend, the knees will extend, and the ankles will plantar flex.
The wrists, elbows, and shoulders are involved as one begins the front squat and the bar is placed on the shoulders. The wrist will be extended to 90 degrees, the elbow will be flexed to about 165 degrees, and the shoulder will be flexed to 90 degrees to hold the barbell throughout the entire squat. At the lowest point in the squat, the hips will be flexed to about 90 degrees so that the thighs are parallel to the floor. The knees will be flexed to 90 degrees or more, and the ankles will be dorsiflexed to 10 to 30 degrees. These ranges may vary depending on a person's mobility and flexibility. Some common mistakes that might occur during the front squat are the elbows dropping. When this occurs, the elbows will come down, the shoulders will tilt down, and the barbell will risk sliding. This also may cause rounding of the back. To fix it, we should think about pushing the elbows towards the ceiling. The next mistake could be a curved spine, which is rounding of the back that can make the squat more difficult and will put unnecessary pressure on the spine that can result in injury. Think about keeping a neutral spine to fix this. And then our last common mistake is the knees inverting. This is when the knees come together as you're lowering or driving up through the squat. It can add pressure and tendons on ligaments in the knees. So to fix this, we should make a conscious effort to drive the knees apart when lowering into the squat and think about ripping the floor apart with your feet throughout the driving phase of the squat.
To do a proper front squat, start with your feet shoulder width apart. Grab the bar with your hands at about shoulder width. Initiate the squat descending. At the bottom of the squat, your thighs should ideally be parallel to the ground or lower. Push through your heels to begin ascending. Fully extend your hips and knees to return to starting position. To have proper technique for a front squat, you need to achieve 90-degree flexion at the knee, which you can see here. For proper front squat, you also need to maintain correct spine posture, keeping your spine straight, as well as pushing your elbows up towards the ceiling that your arms are parallel with the floor. Here's an example of a proper front squat. One common mistake that people make is letting their knees concave or inverting towards the midline. Another common mistake is having a curved or arched spine. This most commonly occurs because someone lets their elbows drop towards the ground and the bar begins to pull them forwards and down. Fix those common mistakes and you too can be properly front squatting.